see a lot of trauma that comes to our hospital, to our ER, to our ICUs. The trauma can be either road traffic accidents, most of them are road traffic accidents. We also have assaults. Now, if we get advance notice that maybe there's a trauma on the road, then our ambulances can go and pick up the patient along with the doctor and a nurse. Otherwise, the patient comes directly to our hospitals. The first place the patient actually comes to is the emergency department, and every day we have at least a couple of sick polytrauma who come to the emergency department. By polytrauma, I mean they have injuries starting from their head, their face, their chest, their abdomen, the pelvis, the limbs, and they will come in shock. That means their BP will be very low, they would have bled a lot. Very often they have difficulty in breathing. So what do we do in the emergency department? As soon as we get a patient coming like this, we would activate a trauma team. Now the hospital has a trauma team which consists of the emergency doctor, the ICU doctor, the surgeons, the neurosurgeons, the anesthetists, the blood bank people. So they all come there, and as they come, and even before they come, the emergency doctors, the team of emergency doctors would start stabilizing the patients. The first thing that we'd actually need to do is secure good IV lines for the patient. If the patient cannot breathe, we would intubate the patient in the emergency department, put them on the ventilator, secure IV lines. Sometimes their ribs are broken. They have what is called collection of air in the chest. We need to put chest tubes, drain that air so that they stabilize. Then wherever they are bleeding, we would handle the bleeding, and then we would have to do CT scans for the patient if they are stable, or once we have stabilized them, to know exactly what is happening inside their body. Ultrasound we would do in the emergency department itself, and then once the team has fairly stabilized the patient, we would move the patient to ICU. If the patient is still not stable, then the patient immediately gets moved to the operation theatre. And in the operation theatre, whatever surgery needs to be done to stabilize the patient or to fix whatever has broken is done, and then the patient goes to ICU. So we see at least a couple of these cases every single day in the emergency department and in Manipal Hospital, Old Airport Road, Bangalore. So we are specialized in trauma care. This is, this information needs to be disseminated.